Every week there's a new headline warning that artificial intelligence is coming for our livelihoods. We are told it could reshape everything from office jobs to creative work and even professions that once seemed untouchable. But while we are scared of future job losses, something much more real is already happening. Countries around the developed world are quietly running out of teachers and doctors. These are some of the most stable jobs in the economy. They don't vanish in recessions, and societies quite literally cannot function without them. According to UNESCO, the world will need tens of millions of new teachers by 2030 just to maintain current education levels. The World Health Organization warns of a global shortfall of around 11 million health workers by 2030. These are not optional jobs. A country can survive without some tech startups. It cannot survive without classrooms and hospitals. On paper, these careers still look stable. In many OECD countries, teachers earn salaries close to the national average wage. Doctors often earn 2 to 3 times the average income. In the United States, the average physician earns over $200,000 per year. In the UK, experienced teachers can earn over £50,000. So why are fewer people choosing these paths? The answer is not just pay, it is pressure. Training takes years. Medical training can take a decade. Student debt is high. Housing costs in big cities are rising. Workloads are intense. Administrative tasks keep growing. Burnout is common. During the pandemic, many experienced teachers and healthcare workers retired early. At the same time, populations are aging. Countries like Japan, Italy, and Germany now have more than 20% of their population over 65. Older populations need more healthcare, but birth rates are falling. In countries like South Korea, Italy, and Spain, fertility rates are close to 1.2 children per woman, far below the replacement level of 2.1. So fewer young workers are entering the system just as demand is rising. To fill the gap, many rich countries rely on immigration. The UK's NHS, for example, employs a large share of doctors and nurses trained abroad. In 2022 alone, over 70,000 health and care visas were issued in the UK. But migration does not create new workers. It moves them from one country to another. Africa carries nearly a quarter of the global disease burden but has only about 3% of the world's health workforce. When rich countries recruit abroad, poorer countries lose critical staff. And even in rich countries, migrants do not always stay. Some move on to higher paying systems like the United States or Australia. If this shortage becomes permanent, the effects will be slow but serious. Class sizes increase, waiting times grow, preventable illnesses go untreated, education quality drops. Over time, weaker education and poorer health means slower economic growth. Technology can help, but only if it supports workers instead of replacing them. AI can reduce paperwork and speed up routine tasks. It cannot replace human judgment in a classroom or a hospital room. The real risk is not sudden collapse, it is slow decline. We may fear that machines will take our jobs, but the bigger question might be, what happens when the jobs that matter most slowly disappear because no one wants to do them anymore?